Good afternoon, everyone. Welcome to this afternoon's webinar, specifically on perspectives and considerations on digital health and digital health standards selection. This is a webinar, I suppose, being hosted by the Australasian Institute of Digital Health, and we welcome you all to today. And I suppose just give it a few minutes to make sure that everybody is joining the call. But while we're waiting, I'd just like to acknowledge the traditional owners of the land in which we're all meeting today and acknowledge their leaders, past, present and emerging. Also like to welcome anybody from Aboriginal or Torres Strait Islander background who may be on the call with us today. You're most welcome. I also like to, before we start, I just also like on behalf of the Institute to pay our condolences to Dr. Harry Nespelin and his family for passing away yesterday. Harry was a good supporter of the Institute as president of the RACGP, and I know we want to pass on our condolences to his family, friends and professional colleagues, which I know a number of them are on this call today, so our best wishes there. This particular webinar is the first part of a consultation process for some work the Australasian Institute of Digital Health is doing with the agency in regards to digital health standards. It specifically is looking at digital health standards selection process, and that process is a generic process that is looking to be designed to help with a formal process of standard selection in digital health. That's not to be confused with digital health standards development. This process would be used formally in the future if it moves forward to help have a clear and generic process for assessment and endorsement of standards that would apply to digital health in Australia for national adoption and use, and would be most appropriately used when there may be one or many standards that could be used at any one time. So it would be an endorsement process to acknowledge that one standard would be used over and above the other. After this webinar, we will have some targeted consultation processes through August, which will get more detail in that with key stakeholders. So that being said, I'd like to introduce Dr. Tim Smythe, who I've asked to facilitate the session today. I met Tim back in when he was Deputy Secretary of in the Ministry of New South Wales Health many years ago now. But Tim's a senior executive across healthcare. He does consulting services and legal services to healthcare and government. And he's also a board director on a number of boards, both PHNs and others. And most notably, Tim's just recently moved to Melbourne this year, and I suppose is dealing with the challenges of living in Melbourne with the COVID crisis at the moment. So with that said, I'd like to introduce Tim. Thank you, Tim.
Thanks very much, Greg, and good afternoon and welcome from lockdown central Melbourne. Don't be fooled by my virtual background. That's a village in Italy on a holiday last year to just remind me when you could take holidays, and it's not a coastal Victorian holiday haven that I've snuck out to. I've got my mask here in case the Victoria Police, or it could be the Australian Army, knock on my door during the webinar. And I guess in the current COVID-19 landscape across Australia, perhaps the first health standard that we really do need to agree on is a standard for applying for border crossing passes or a permit to actually get out of Australia. However, let's move on and I'll quickly introduce our 5 panellists and get our discussion underway. And from having a quick look at the attendee list, I think many of the panellists will be known to most of you. Bettina McMahon is the interim CEO of the Australian Digital Health Agency and has held senior positions in the agency and its predecessor, the National Electronic Health Transition Authority, for well over the past decade. David Rowlands is a management consultant specialising in health and health informatics. He's a director of the Australasian Institute of Digital Health, and in conjunction with HISA was the driving force behind the launch of the online Digital Health Workforce Academy. Graham Grieve is a health informatics consultant, and he's the fireman of digital health. Now that of course is FHIR, the International Interoperability Specification for Electronic Exchange of Health Information, but I'm sure Graham would not disagree that he's also known for constructively starting a fire or two on the digital landscape in his career. In addition to being HL7's product director for FHIR, Graham has a national and international track record in the development and adoption of digital health standards. Michael Walsh has held senior executive positions in the New South Wales and Queensland health sectors and was Director General of Queensland Health from July 2015 to September 2019. He's chair of the Digital Health CRC and chair of the Australasian Institute of Digital Health. And with Powerhouse Partners, Michael provides strategic advisory services on digital health, governance, leadership and strategy to keep clients across Australia. And our fifth panellist is Philip Loyola, who's the director of the Medical Software Industry Association and is also the lead solution strategist with Cerner Asia Pacific. He is the MSIA Task Force Chair on Standards, so he's very well placed to contribute to our webinar discussion this afternoon. And through his work both with the MSIA and his Cerner role, Philip has been involved in many health and regulatory standards working groups. So I guess to kick the discussion off, I guess a question that many people will have is, well, why embark on a digital health selection process now? It seems to have been a bit of a patchwork without much coordinated momentum over the past decade. So perhaps Bettina first, why has the agency asked the Institute of Digital Health to help with a consultation process to re-engage and to restart this process?
Hi Tim and hi everyone, thanks so much for joining us this afternoon. Look, there's two things really I'd like to respond to in terms of the why now. The first is we have been engaging with the technology industry and the standards community on specific projects over the last couple of years. So most notably EPP or electronic prescribing, we've had a working group and we've been developing standards and we've made some really good progress there. Secure messaging is another. But what we've done really is we've had an organic process, we've defined a way and we've kind of worked through that. And while that's worked, what we'd like to do is bring some consistency to the approach that we adopt in the standards and specifications identification. And as you mentioned earlier, Tim, there is some need for development, but right now we're just looking at, well, what would be the process for identifying appropriate standards and agreeing those so that it's not a government dictating that. So we've done that in the past, and we're seeing an increased need for more standards, particularly with interoperability. So the agency's at the point in our progression of interoperability in line with the digital health strategy that we're about to start having those conversations about which standards should apply. So that's the first part. Now, the second part, which is more of a burning platform and an internal government thing, I guess, is that we had an audit last year by the Australian National Audit Office. So that's one of the key accountability mechanisms for a government agency to government. And in that report that was tabled in November last year, one of the recommendations was for the agency to develop an assurance framework for third-party software connecting to the My Health Record system in accordance with the Information Security Manual. So behind that recommendation really was a recognition that while there is security applied to the My Health Record infrastructure, the way that health information is managed outside that infrastructure but connecting to it can create some shared risks for all of us to manage. And so they said, look, having some basically baseline security standards is something that we would expect. They suggested the Information Security Manual, but in our response to the ANAO, we said that while we agree with the recommendation of having some base level standards, we don't think the ISM, the Information Security Manual, is necessarily the best set of standards. And what we would do is we would work with the industry to identify the most appropriate set of standards. So we have 2 years to implement this, this recommendation. And what we'd like to avoid is just saying the ISM is the standard. We'd like a process to work through that standard selection with the community. And we thought, well, look, why not actually develop an agreed way to do this for this specific piece that can then apply to that broader piece of work. So really there's a time frame, which is always helpful for government. And David Rowlands last year, I started talking to him sort of mid-year about how we might pick up some of the recommendations that he had made to us, with an impetus of a government reporting deadline, which focuses the attention of people like me and others in government.
Thanks, Bettina. David, perhaps might ask you to provide some additional comment about your perspectives on the current sort of context and where this process sort of sits and how you see it going forward.
Sure. Thanks, Tim. So you mentioned in your introduction the last 10 years. So about 10 years ago now, Australia made a very significant change to its standards program for health informatics. And that came about in the context of a hasty move to a personally controlled electronic health record, as it was called in those days. Now, that significant change, in my view, was not necessarily well thought out as a comprehensive policy change in standardisation, but it had the effect of being one. And it was a bit of a policy of dismantling rather than re-establishing something. Ever since, standardisation in health informatics and digital health in Australia has been in a kind of limbo, neither heaven nor hell, but a holding pattern somewhere in between. About 12 months ago, or a little more than 12 months ago now, under Bettina's leadership, the agency began to look at how it might move out of that limbo position, or how the country might move out of that limbo position, preferably in the direction of the light rather than the darkness. And the way the agency did that was to leverage work that it had in hand. So I was doing a piece of work on interoperability, and it said, okay, we've got an opportunity here to use some of the resources on that interoperability program to not just look at the standards for interoperability, but to maybe look at the wider landscape. So I was commissioned at that point to do a piece of work on standards development. I pointed out pretty early that you couldn't just look at the standards development piece without looking at all of the parts of a cycle that lead to standardization, which is what you're actually trying to get to. Standards in themselves do nothing. Standardization is the goal. And while my piece of work did have to focus on standards development, I did paint a broader picture. Since I delivered those recommendations about 12 months ago now, as Bettina pointed out, the agency began to go through the often painstaking process of bringing a wide range of decision makers and potentially funders along. And then a couple of icebergs popped up. The agency's CEO resigned, COVID came along, etc., and that's resulted in some disruption to just about everything we know, not just the world of standards. But this initiative, I think, is another demonstration that what the agency can do is to use bits and pieces of work in its existing program, the thing that's actually been, the specific things it's actually been commissioned to deliver, to build something a bit beyond just those projects, but that takes us towards a broader approach of standardization. So while we might be talking about standards selection piece today, just as we were talking about standards development last year, I'm quite sure that Bettina and people at the agency do understand that there are many pieces to this jigsaw that need to be worked on. But at the moment, they have the scope to put a piece or two onto the puzzle and start building from there. So that to me is the overarching context here. Something
Thanks, David.
quite big has been broken.
Mhm.
It can't all be fixed in one fell swoop, but there are pieces of the puzzle that can be worked on as we go.
Great, thanks, David. And perhaps we're following the Pope. The Pope's abolished limbo in the Catholic Church, so we're about to do the same in digital health in Australia, which would be good. Before moving on, perhaps I was going to ask Michael Walsh about why we need to actually do this. I was going to just check with Graham. Any other comments and perspectives from you on about the value of this process and the need to do it? Might need you unmuted. That's it.
Can't hear you, Graham.
Can't hear you, Graham. While you're sorting out the sound, I might ask Philip the same question. So from the Medical Software Industry Association point of view, and also Cerner being a major vendor in this space, is that what's your perspectives about getting this process underway and why we should get it underway?
Yeah, thank you for that. So I think we support it. I have two different hats on, as you've already said, but the industry definitely supports the need to have some standardization, because the goal here is to make the clinician's life easier. And to do that, there has to be some interoperability amongst systems and to share data among those solutions. And so we want to see ways that that make sense, that fit the clinical workflow and the intended use cases, and then make sure that there's enough time where we can pick those up. I think there's a lot of good ideas that have been out there for a number of years that haven't had necessarily the uptake, just because everybody's not aligned in all those, I guess, in that development and the uptake of that solution. So one of the key things that I think is here is making sure we're meeting those workflows, and then we have a way to then transition into that where everybody's aligned on that goal over a period of time, so that we can see rapid adoption and actually value coming from that standardization.
Thanks, Philip. And later on the discussion, come back to you particularly about a viewpoint of MSIA on how they'd like to see that engagement process undertaken and getting that buy-in. Graham, have we got you back on sound?
I hope so. Does it work?
Yes, we do.
Right.
Off you go. Interested in your perspective on those initial comments from Bettina and David and Philip.
Certainly, we need to acknowledge that we're not in a happy situation now where we don't have a practical ability to produce meaningful standards for digital health standards for Australia. And there's been missteps by multiple parties in the past that led to that position. We need to move past that and rebuild trust. You know, my job on an international level is to maintain trust, but it's really hard to build it and maintain it. And so we certainly need to think really hard about our governance approach in a way that will make all the parties who need to be involved trust the process. And while, you know, I recognize the reality of Bettina and David's comments around where we're starting from, I just want to be really clear to everybody on the webinar that this is not the ideal place to start in some kind of fantasy theoretical world, but we start where we start. We have to understand the limitations. The ANAO report gives us some teeth to work with the process, but a lot of the people on the call will come from a slightly different perspective. And I think it's really important for you all to pay attention to the difference in perspective and the importance of the word selection in this discussion here, as opposed to what most people would immediately think of, or the kind of thing I'm more involved with, which is development of a standard. So just calling people out to pay attention to that. And I think I know that the agency is working towards publishing David's report from last year, and I hope that we can get that through quickly. And thanks, Bettina, for moving on that, because I think that will give people a lot more context to what's happening. It's not going to be what we're going to do because things have moved along, but it's certainly going to give people a lot more context around how to think about the discussion. I think David's work was a really significant contribution.
Thanks very much, Graham. And I'll come back to Bettina in a minute to perhaps to elaborate further on sort of what already exists and background material that'll help with the process. But going over to you, Michael, in terms of from both a national and international perspective, why bother with trying to select and standardise standards in the digital health space? Whoops, we need you unmuted as well, Michael. That's
Thank
it.
you very much, Tim. Thank you for reminding me. So clearly, the increasing use of digital health is extremely disruptive to the system, as we've seen over the decades where it's been rolled out. We've got major developments happening in primary healthcare. We've got increasing use of in the virtual care space. We've got increasing rollouts of hospital EMRs across Australia. And we need to ensure that the interests of those who are intended to benefit from this, and that is the citizens of Australia, the people who receive healthcare services, the clinicians who provide those services, and then the systems who fund and operate those, all three, the consumers, the clinicians, and the systems all benefit from this enormous disruption. I think it's to continue the analogy of limbo's gone, but using your background, Tim, Rome wasn't built in a day, nor was the world, and I don't think that digital health is going to be sorted in a day either. And I do think we are living through a disruptive transformation that we need to ensure we are identifying those areas where we need to strengthen at the times when we see they are best placed. When you take the comments that have come by other panelists, we actually do need to ensure that the systems that are currently built and that we know that we need to be built in the immediate future, but then also the longer term, we need to have in place ways to ensure that the data that is traveling around that is interoperable, can be used easily across platforms, that it's serving the outcome, the health outcomes we're wanting for patients, and that their experience in the health system is improved, that clinicians deliver a safer and higher quality healthcare. That's why we have standards. That's why we've got to develop them as we develop the entire network. I do think Graham made a very good point, and I think this is important to recognise in this process. This isn't about standards development. This is about saying we need to identify what's there already, the standards that are out there, and which ones should apply here. So it's the process of identifying which ones apply.
Thanks, Michael. And I mean, in that context, we're not really starting with a blank sheet, are we? Because there are standards, and I'll come back to Graham in a minute on this as well. And there's also these sort of processes been underway in other countries and other jurisdictions. Sort of who's doing it well? Is the lessons that we can learn? I'm not sure. So the United States and the Office of the National Coordinator of Health Information Technology, leave aside things to do with coronavirus and the coming presidential election, but the work that's been happening there, the work that's been happening in the European Union, the Global Digital Health Partnership. So there've been other processes underway, Canada, the NHS. Is there anything we can learn from what others have been doing? Michael, and then Graham, and perhaps I'll come back to Bettina and David on that.
I think, Tim, that those activities that have happened in other countries are enormously beneficial to us. I wouldn't call them misstarts in the past. I think it's just the best endeavours of well-intentioned people. But when we look at other countries, we have to take what they have done successfully and apply it here. One of the things that we know is that you have to engage those people who have the knowledge and experience in this space, as well as a focus on the consumers that are going to benefit from this. So you do need broad input into standards, and sometimes they can be extremely technical and complex. But there are varying degrees of complexity and technical detail. I also think it does have to be transparent and defendable, because there are some people who would say that, you know, their standard's better than someone else's standard, and you've got to have a process that ensures that the broad community supports whatever decision is made. So I think it's really important to have a robust, transparent, accountable, and defensible system, and I think that's what the agency is intending to have in place.
Graham, any sort of comments on where others have been doing this well and we can learn from them?
I do particularly want to call out the ONC ISM, the Standards Advisory ISA, I think, that they publish on a regular basis. It's a significant investment on their part to provide industry with advice, and it's a cooperative process. I think that's a significant piece of infrastructure to lead towards a longer-term solution to some. There's been a bit of comment in the comments about stability in the standard space. Clearly, I helped in that regard, and a lot of countries are struggling with trying to manage the cross currents between technological development, policy input development, business pace of change, and trying to hold the standards together. I don't think that there's any country that's got it 100% right. It's more that you can pick and cherry pick from the different countries. But I think the most important thing is to be able to create and maintain a viable partnership between the regulation process and the technological development, and then the informatics process, that is a viable, trusted way forward. And I think, to me, that's always going to be the key, is identifying what elements led to greater trust, nurturing those as we work towards getting a process that works.
Thanks, Graham. Philip, any comments on what we can learn from others and features that you'd like to see of this process?
Yeah, agreed with a lot of what Graham's saying. Cerner has a significant experience in a number of those markets that Graham is talking about, and I agree that over a period of time there have been a lot of lessons learned, and we need to try and take the best of those to support the Australian landscape. But I think some of the other lessons learned that are useful there kind of go again to kind of my thought process before, of making sure that we're all aligned to actually use these. So it's beyond just establishing the standard. It's what is the use case of the standard, who's going to use it, and then we're aligned to actually get success out of that and adjust if we don't, so that people can actually get the value, that our clinicians and ultimately our patients are better off because of that. Tim, I think you're on mute.
It's my fault. Sorry. I was going to say, David, any comments you wanted to add before I come back to Bettina?
Yeah, I mean, I think what we can take from other places are some of the critical elements that are required. We can't necessarily pick up the way those critical elements are provided, but we can certainly find, and I pointed out a number of them in my report of last year, we can certainly find some factors that are critical to be addressed. Things like leadership from the most senior levels. I mean, I happened to be in the audience at Davos for the World Economic Forum in 2017, when then Vice President Joe Biden, who had about 3 weeks to run at that stage, but he got up and he made a very eloquent speech about the need for technical and data standards in health. Now, I could have fallen off the chair Vice President of the United States talking about this stuff. But he'd been through the personal experience of having lost an adult son and experienced data disconnects and all of that sort of stuff, and obviously asked a few questions why, and got a bit of a picture of why that happens. In the UK, the Secretary of Health and Human Services equivalent is very eloquent on the need for standards. Here, if ever I've heard a politician talk, any politician talk about standards, it's, I'm sure, just been a word on a pre-prepared page. I haven't yet gained any confidence that anyone's really terribly interested at that level. So leadership from the highest levels is a critical success factor. Capability and resourcing, like Graham talked about with the ONC, the European Union has a significant program behind its standardisation work. And in the UK, there's a very strong coalition currently working in which a whole number of parties are putting in resources, including the government. You just can't do it without some resources and mechanisms to make things sustainable. Expertise, community, you know, you can't, this is not something that you can just pick up when you want to pick it up and then put it down and assuming the understanding will be there 2 years later when the next project happens to come along. Complex endeavours aren't like that. Hospitals don't run like that. You know, just ask Michael Walsh what would have happened if, you know, the best surgeons in Queensland Health had said, okay, well, we'll just take a couple of years holiday and then we'll come back and do the operation again. What would their quality and safety be like? You know, complex endeavours don't work that way. So there are these whole series of things that we can see are absolutely critical to what needs to be done. And we've got to find our own way of putting those pieces together, because that
Bettina,
looks different in the US, the UK.
How do you see that? How do you see that happening? We've seen that perhaps in other sectors, the telecommunications sector's agreement on standards, so mobile phones can talk to each other, in the banking, etc. How are we going to sort of build that consensus in relation to the digital health space, and particularly this process to select standards?
That's the $1 million question, and really what I look to from international effort and effort in other sectors like telecommunications, which I think has done it quite well, and financial services compared to others. I mean, I'm sure people involved in that can see how difficult it is back to a point Graham made earlier about, you know, people are coming from this from a different perspective. And I think that was in reaction, Graham, to when I said, well, look, we've got this ANA report, and for us that focuses the mind. And I think your point was, well, it might be important to you, but no one else will really care about it. And I get that. You weren't that blunt, of course. You're always far more diplomatic. But I think it's understanding what are the motivators for different participants. For us, it's something like that. It gives real impetus to government, and it doesn't mean it should have impetus to anyone else, but there are others who will have drivers as well. So I look internationally at that. A couple of comments in the Q&A from Mark Nevin and Mike Bainbridge about, well, how do you involve clinical and other stakeholders in this? So I'm really interested in how do you get people motivated from different backgrounds and perspectives to properly engage in this. And and just a quick plug, thank you for putting your questions in the Q&A rather than the chat. When it's in Q&A, everyone can see it, so please continue to do that. And then the second part is really, Tim, the criteria for success. So I think the way that we can try to make this successful is to understand what are those criteria, and I've been talking to a few people about that recently, Emma Hossack on Friday, and a few others, and we hope to through this process. So, you know, a clear and common goal about what we're trying to achieve. Understanding what did the leaders do. So, you know, you talk, David, about leadership and gave a clear example of something that a political leader did, and Graham talks quite a lot about commitment to standards, but what practically did that look like in different countries? And then for me as well, understanding the community sentiment on an issue, because that is different. So I'm less interested in which standards are different countries using than what's their starting point culturally, what are the perspectives of the stakeholders, and how do they actually carve through that to get interoperability, because also some of these things you look at a whole lot of work and money and effort that's put in, but you don't get an outcome. So I'm really interested in ones where they actually get an outcome.
Michael, you got any comments about the process here is that we're looking at standards selection as distinct to standards development, and how that process might work and work well in the Australian scene, particularly in the sense of building this consensus and engagement.
Yeah, thanks, Tim. I do think we have to look at the way that the system is currently operating, because we are in fact already applying a number of standards in the way that digital health is working across Australia at the moment. And so we need to look retrospectively to identify how did those standards become arrived at. And then moving forward, as I've said before, we need a process that fully looks internationally, that is open, accountable, transparent. And I do agree with Graham that the intention here is to build trust. It's trust from the community that their data is safe, secure, and reliable. The same from clinicians, that it's easy to engage with. I think the one thing I want to add, Tim, is identifying standards. The process of identifying standards is not something you do once off. It actually has to be a continual process of review, because things do change a lot. And I'm seeing some of the comments come through. We can't just choose a standard, then say, okay, that's done, finished. We actually have to continue to go back and look at that. And I think the best way to do that is collaborative communities. You actually need to fully engage with people who are at the cutting edge of the digital health transformation in order to inform that process.
Thanks, Michael. Back to you, Graham, is that the Global Digital Health Partnership, and Australia's a member of that partnership, released a white paper last week on advancing interoperability. And the paper recommends creating a global master standards guide. Do you think that's a good idea?
It's an idea. I think that one of the challenges, always a challenge for me in the fire community, is to try not to become too insular and to always search and seek out appropriate external standards so that we don't add to the problem wherever we can. And that's incredibly difficult because, for instance, there's a open banking specification here in Australia. So of course, why would we do that? But in America, the USA, there's not kind of no equivalent. And so there's quite a bit of interest in extending FHIR to cover banking transactions, which just seems insane to me. But they're very different standards environment outside health, and very different governance around that. And so that's just an illustration of the kind of challenge there. And I think that the various national leadership, is very strong desire to work together, which I think is really great, but also a lot of practical challenges because they respond very strongly to their own internal political drivers, which they have to. And so it's hard for me to see that becoming a really significantly influential piece of work. But I don't want to be negative because I think that it would be a really great thing if we had that. Just a huge piece of work.
Yeah, undoubtedly a big piece of work. Philip, coming back with Medical Software Industry Association, we're in that hat, but also your Cerner Asia Pacific role. How would you see getting engagement and traction in this process of consultation about developing a system for standard selection as distinct to standard development? I think it's important we remember we're talking about standard selection, not standard development in this consultation exercise. So what would you see as some key things to build that engagement and actually get some traction?
Yeah, so I think one of the biggest pieces is looking at the industry groups, looking at the peak clinical groups along the way, trying to bring some of our best technical advisors along the way into these sessions where we can have some of the discussions around what are the pros and cons of some of the standards, what is available internationally and nationally, and recognize if that meets the local Australian needs. And so there's, Graham's point is very valid around, there being different environments in different regions, and even those that have some similarities. And so we do need to get together and look as that group and really kind of make sure that it is meeting the goals for our clinical folks, for our patients. It's also something that keeps a vibrant industry. So one of our goals in the MSIA is to ensure that Australian industry can go internationally, and that we maintain a competitive landscape for those that want to compete in Australia. And so looking at some of the standards that are available everywhere is useful, because it can help Australian industry go be competitive on the national and the international stage, but also vice versa. And there may be times, and we see that in certain instances, where something unique to the Australian instance is required, and that's where having these local groups and maybe not necessarily following a global standard full stop will work necessarily for us.
Thanks, Philip. And just conscious of time, and we've got over 30 questions, and Greg and I are going to see what we can do best to curate some of those questions, and also ask the panelists to certainly contribute at any time about that. One question, or a number of questions, have asked about what would be the governance structure for this process, both and in particular longer term, rather than this is a one-off process, which is a comment that a couple of the panelists have made, that there's, and Michael made the comment that it's a continuous review process, and not reviewing every day, but you'd certainly want to be reviewing every couple of years in terms of the selected standards. Comments that perhaps start with Michael, and then Bettina and Graham, about a governance process. Although obviously that's part of the consultation, is asking people what they think rather than providing the answer.
Thanks, Tim. Happy to start. I think Bettina's probably got more relevant comments. The point I would make in terms of governance is that we are talking about a sector of standards within digital health. There are numbers of other areas of standards in digital health. If I just use one, it's the clinical standards. Just in relation to human factors. How do you present data on a screen to a clinician in a consistent way that we know is more likely to result in good clinical decisions? Now, that's not the area that we're looking at here. So it's actually the Digital Health Agency that needs to set the boundary for these standards that we will be talking about. And then clearly they will lead a process. It has to be inclusive of the sector, the knowledgeable people, but also drawing from a broad range of experience. But clearly I would see the agency as leading that in a way that involves other entities, but also individuals.
Bettina, any comments you wanted to make?
Yeah, if I can start with a reflection on something that Mike said earlier, which is that the selection process, you don't do it once and then you're done. And I think in that comment lies the key to this, and I'll come back to governance in a moment, in that it's liberating, because at times all of us have been sucked into this trap where you have this opportunity to do this once, and so you try to get it all perfect, and you end up spending a whole lot of time on the really edge cases because you want to get it absolutely right. And I think a recognition up front that it's not a one-off exercise, that it's an ongoing process that we're looking to set up with a sustainable governance should liberate that, such that we can accept what is going to be good enough and what's going to put a stake in the ground in a particular domain for improvement. So whether that's around security standards or something else. So I think that's the key. And then in terms of the governance, in the conversations I've had with other members of the panel recently, I had to break this, but I can't see a way that we're going to get absolute 100% consensus on every standard selection process we go through. It will be contested, and there'll be different views, and we will end up with different points of view. So the critical part in this, to actually getting a set of standards that everyone can implement and live with to get to an outcome of improving processes and interoperability, will be that everyone is comfortable with the governance and the process followed. So I think, in my own organisation, I'm comfortable living with decisions that I don't agree with if I feel that the process that was followed was true to what we had agreed would happen, and I'm comfortable that there was proper due diligence applied. And so for me, I haven't got a predetermined outcome about, who it is who should chair this group or how it's going to work, but I do strongly believe that we have to get consensus on the process so that we can live with a diversity of opinion for things that come through the process, and that people can stop contesting it once it's been through that process. That's my objective.
Thanks, Bettina. And another interesting question is that there's quite a lot of digital health standards already. FHIR is obviously one, HL7, IAT. But this question is saying, could the panel comment, should Australia be a standards taker rather than a standards maker in terms of just selecting what's already there? What sort of gaps do we actually have where there isn't something there? I don't know, Graham, do you want to make a comment on that? And
Yeah.
Philip and David?
I'll also comment about governance as well. Consensus isn't going to mean agreement. It means that you can still come to an endpoint that people can live with. Critical to that is to be able to have an open debate, which can be quite challenging, be quite open and confrontational at times, because people really believe in what they believe in. And so I've always thought that, and I teach this around the world, that you really need a good partnership between an NGO to take that technical risk, so that you're not having political damage from that robust debate. And so there's a real need for a partnership between the regulators and a technical standards organisation in order to manage that risk. So a key part of governance is understanding that that has to happen, that debate. And then, to me, a very key part of any governance is how you guarantee to all parties that openness will be preserved and maintained. The US process has a gorilla looking over the shoulder. That's a really key part to the process, and that we always make sure that we are transparent and open, because we can get called on it if we're not. On the terms of taking or making, it can never be either. You can't make standards without using them and without sharing the process. And you can't only take because no one's making standards for you. And why would they? It's a collaborative process that you put in and you get out. Some individuals of us may make standards on an international basis, but as a country, it's got to be being part of the community that drives the standards process forward, and all across the life cycle and throughout the community. And so I think that, we should continue to constructively contribute, but at the same time, we should be very clear, why are we doing what we're doing? How does it benefit us as a nation?
Thanks, Graham. David, you'd made a comment earlier about a jigsaw, and I know also, Philip, with your role with MSIA, is the TGA has been looking at regulatory framework for medical software and devices and things there. And there's work happening with other sectors and in Australia on digital work. The COVID-19 has led to a lot of general practice discovering the telephone again, and hopefully will lead to actually broader virtual health. How do we sort of get this process, and I'll ask Bettina as well, how do we get this process that we're about to embark on as a consultation, the outcome of that process to actually fit into that wider jigsaw? You're on mute, David. Thanks. Still on mute. Oh, there you go. You're right.
I was so determined I wasn't going to fall for that. Look, I think the reality here is that circumstances, COVID this year, it'll be something else next year, it'll be something else the year after that. Circumstances always change. And that's why I was talking earlier about not just doing things via the next project that comes along or the next issue that comes along, but having some ongoing capacity. I mean, even if the surgeon isn't working in the hospital today, you know he'll be working there or she will be working there tomorrow, so you still have to retain the capacity. We have to build mechanisms, structures, capabilities, recognizing that they need to move across a changing landscape, because the healthcare landscape is always changing. So that does tell you something important. It tells you some important things about expertise and maintaining expertise and valuing it. It tells you something about ongoing leadership, not about just periodic leadership. It tells you something about reliable, sustainable funding and other kinds of resourcing. It tells you a number of characteristics that you need in this system of standardization. And that gives me the segue into the other point that I'd make. And that is that the game is not to develop or to select or assess conformance with standards. The game is always standardization. That's the thing that adds value, not the existence of standards or a process of choosing between them. And so the governance process that we have has to have an element of synchronization across standards development, standards selection, conformance, capacity building, education, all of those parts that lead to standardization. If we go down the path of saying, okay, we need a governance structure for standards development and a governance structure for standard selection and a governance structure for conformance testing and a governance...
we're going to need a governance standard for governing the governance standard. Yeah.
Yep, exactly. We need a one of the vital things that I think is missing is that synchronization or orchestration function.
Okay, thanks, David. Coming down to the last few minutes of this webinar, and then before going back to Greg, I'll explain a bit more about the ongoing consultation process. Just to check about Michael, then Philip, any sort of concluding comments, and then back to Bettina. There's another question about why should clinicians be interested in this? Is it just a technical backroom discussion?
Thanks, Tim. Addressing that point, because I think that's actually a really important point, is that both people with a technology background and clinicians are interested in safety of the healthcare system, and in this space, the digital healthcare system. And so it's important that clinicians have a say, because it's actually going to impact how they interact with the platforms and applications and modes that they deliver digital health care through, just in terms of speed, interoperability, and also an important one that I know for me personally, but also for everyone working in the healthcare sector, is how many clicks is it going to take, and is the standard going to increase the number of clicks or reduce the number of clicks? And how does that work? So I think safety and quality is actually everybody's business, and everyone is actually interested in it, and therefore it's important that clinicians are involved, as I do think consumers' involvement as well.
And certainly in online shopping and Amazon, they've certainly solved the number of click problems, haven't they?
Yeah, you can buy something even without clicking.
Philip, any concluding comments before I go back to Bettina?
Yeah, I think the panelists have all raised some really good points, which have stolen some of my thoughts along the way. But one thing that I would add to this is I think we need to think about the ecosystem as a whole. So it's not just how do we select a standard? Is the standard good? Does it need a workflow? Some of those elements. We also have to think about how do we actually then use that standard and get it into the hands of the clinicians. And so Mike had a great point around the clinicians. It needs to be safe. It needs to function, their expectations there. And I think that's one of the key elements here, is making sure that there's alignment across the different groups. And I think that's where we've had some challenges in the past, if I'm honest, in that you know, some of the really good standards that have been established haven't had strong uptake because there hasn't been that alignment. And it's something that I know that the industry has challenges with. We all have challenges in that we cannot make our sites, our clients necessarily upgrade or turn on pieces of functionality or move to a standard if they're not seeing the clinical value, the business value, the financial value, whatever that intended value is going to be. And so making sure that there is that alignment there from the get-go to implement the standard is how we get then to success and make something hopefully easy, safe for the clinicians to be using.
Thanks, Philip. And Bettina, just any final comments before I do a little bit of a summary of what I think I've learned from the panel discussion, and then we'll hand back to Greg.
Quick takeaway then, and something I'd like to leave with people. So a couple of takeaways. First is I'm still floored by the fact that purgatory doesn't exist. I missed the memo, so that's awesome for me.
I think it was limbo went. Purgatory might still be.
Oh, okay.
I think which bit of the church you're in.
yeah, okay, all right. So so there's that, and I guess, you know, as a symbolic point, I've really appreciated the honesty that people have brought to this today. We're not going to leave behind the past, and in fact we don't want to do that. In some of the conversations I have with Graham, it's really important that we embrace where we are and why we are where we are, and you'll see a lot of that when we publish David's report. So that's in the process, by the way, that it'll get up on our website in the next day or so, and it's not for the purpose of dwelling too much, but it is recognising where we are and building from there. The other thing I think is really interesting is some of the comments around clinical involvement. So George Margellis, the comment you make is that the actual process can be really technical and impenetrable for clinical users, but the point that Mike Walsh has raised about the imperative to get them involved. So that's a nut we haven't cracked yet, and I'd be really interested in just looking practically about how you get people to get involved. And one thing I'd like to leave with this group is we've had a lot of discussion today about governance as a concept and a process that we'd apply, but we need to somehow have that discussion at a level of abstraction, but it needs to be grounded in what's actually going to be achieved. And so a few of you have also made that comment. So let's stay focused on the goal that we're working towards while still dealing with the abstraction for the purpose of being able to reapply it. But that's our challenge, I think. Thanks, Tim.
Thanks very much, Bettina. And before handing back over to Greg, my sort of takeouts from the discussion that we've had over the past hour is that there's certainly an agreement that we do need to have as a desired outcome a regularly updated set of agreed, effective and required standards within the context of standardisation across the digital health space, and ideally aligned to international best practice. But we need a process that's transparent, that engages, that builds trust, and we need a process that's going to continue, not another one-off project. And how we blend this, the technical expertise and the technical work, but ensuring at the same time that clinicians and other key players are engaged. So on behalf of all the participants, I'd like to thank our panellists for their contribution, apologise for the facilitator not unmuting himself at the appropriate times, and hand back now to Greg for a wrap up of what's the next stage in this process.
Thank you, Tim, and I'll be very brief here. So thank you, Tim and panellists, for being part of this conversation today. It's very welcomed. We're just going to put the screen up just to share this consultation notes. So as I said at the start of this, this is part of a start of a consultation process for the project on standard selection. So some invites have already been issued in relation to the actual consultation sessions, which are starting next week and the following week. If we had a targeted list of people that we've actually sent them to, if by chance you haven't received that, or from listening to today's conversation, you'd love to be involved, my details will appear on the screen shortly. There they are. So I'm the prime contact for the, just let me know. And thank you for all the questions that were received. Obviously they weren't all answered. Some did relate to standards selection and others to standards development, but we'll endeavour to get back to all people and answer those questions or relay them on to the right appropriate people. So thanks again, Tim, for hosting this conversation, and thanks everyone for your time today. It's been very welcomed. Thank you.
Thank you.